Good afternoon, everybody. I'm Dr. Teresa Anderson, and today we have a special guest on our Psych Waves podcast. This is Dr. Rebecca Berens, and she's a primary care provider in Texas. Dr. Berens, I'm so pleased that you're on our chat today, and I wanted to introduce you and a little bit about what you did. And yeah, let's get chatting.
Yeah, thanks so much for having me.
I appreciate you coming on. So, what is your primary focus, Dr. Berens?
So I'm a primary care physician. I'm family medicine, and I have a private practice in Houston, Texas. And I see all ages, from newborns to elderly, for general primary care. But I have a lot of patients, and probably my area of specialization is women in sort of their late 30s to 50s, many of whom have experienced a trauma or an eating disorder or some combination of that. Many of whom have also experienced weight bias in their healthcare, and so I provide a inclusive and trauma-informed safe space for their primary care services.
That's fantastic. So many times you guys are like the front lines. As a psychiatrist, I can say you guys are the front lines to seeing what our patients who eventually come to us are doing. And how did you wind up in that space, in that niche?
Yeah. I mean, I'm often, like you said, I'm often the first person the patient's ever told about something that they've experienced. But I mean, I ended up in family medicine just because I was interested in preventive care and trying to prevent serious complications of chronic disease or psychiatric disease, or because if we can catch it early and address it early, it's much easier to treat and has less of an impact on the person's life. So that's what kind of drew me to family medicine. But I've had my own experience with an eating disorder, my own experience with trauma, and that has just sort of informed my approach to practice since I was a medical student. And I think as a result, naturally has attracted patients who are looking for that.
Absolutely. Absolutely. And is that something that you struggled with just in medical school or residency or high school or?
Yeah, so I had my eating disorder when I was in college. And I was, sort of recovering in medical school. I wouldn't say I was fully recovered probably until after residency, really, because
Hard to
that's
recover.
not that's not an overnight process. And so, that was sort of the beginning stages of that. But I actually was in an abusive relationship when I was in medical school that almost resulted in me being killed. And so that experience was also very informative to me in terms of obviously experiencing some of the post-traumatic stress symptoms after that, and the sort of the red flags that you can pick up on with patients who are maybe going through something like that, but either don't realize it or don't feel safe to bring it up to anyone or to ask for help. And so, just because I've had those experiences, I think I can kind of pick up a little bit easier when a patient of mine is experiencing something like that.
That's amazing. I'm really sorry to hear that you've gone through that, but I think it's amazing and impressive that you feel free to share that openly. And I think it gives a lot of people in the traumatized position hope that it's okay and safe to share with you being a provider. And I think a lot of people, are sort of biased and think, oh, well, you're intelligent, you come from a good family, you're successful, you're a physician. How could this happen to you, right?
Yeah. And I mean, when it did happen to me, that I felt a lot of, I was like, how could I let this happen to myself? Like, I'm not stupid. But that's when you sort of realize like how easily it can happen. And it really has nothing to do with your intelligence or your upbringing or anything. Like it's just a very, very common, problem. And it's very accepted in our society, actually, and actually like glamorized somewhat in our society, like some of the traits and behaviors of abusive partners. And so, especially when you're young and I would think I was 20 when I started med school. I graduated college early, so I was young. And your frontal lobe is not fully developed, so you still have a lot of influence from your sort of adolescent brain. But I mean, even still, like even in later adulthood, like I said, I mean, these things can still happen to you because it's very accepted in society, and it's very stigmatized to bring it up or ask for help. And people are just not even aware sometimes that they are being abused because it's so normalized.
Absolutely.
Yeah.
there's so many patterns too of, for lack of a better term, predators in our society that have the whole love bombing aspect, and they'll kill you with kindness and flowers and gifts and favors, and it's sort of a fake way to be emotionally intimate, and there's my cat, emotionally intimate with someone before actually knowing them. And once you're involved, it's sort of hard to get out of the scenario, especially if they're emotionally or physically abusive. It's hard to sort of detach yourself from their friends, from their family, from the social sphere. And there's a lot of shame involved. And like,
Mm-hmm.
how did I let myself go down this path? How did I, yeah. As women, I think especially we are prone to beating ourselves up, even if nobody else is beating us up for ourselves. So
Yeah. Well, but and to your point, like the the process in which it happens is by necessity you have to be isolated for them to be successful, and so that's one of the ways that it's so easy for it to happen is, you know, like you said, you start with this relationship, there's the love bomb, it seems like very, you know, open and kind and loving. And usually when that's going on, like your friends and family are like, oh my gosh, they're so great. They're treating you so well, like blah, blah, blah.
very flattering.
Yeah,
Like,
yeah. And
yes.
then little by little, just sort of insidiously, they pick away the support system that you have. And then the abusive behaviors escalate. And by that point, you don't have anywhere else to turn because they've kind of picked apart. They're really good. They can pick the ones that are going to stick up for you and help you and leave you with the ones that are kind of more oblivious. And then you're kind of stuck. And you also know that, I mean, I knew this as a med student just from the statistic, but like this is fairly common knowledge, I think, um, in the public as well. Like the greatest risk of homicide is when you do try to end the relationship, and it has to be done very, very carefully. And you can tell when you're in the situation how risky it's going to be, and it's very, very hard without a really good support network to be able to take that step and do what you need to do.
My my primary sort of bread and butter is treatment resistant depression and PTSD. And I treat so many victims of domestic violence, emotional and physical sexual abuse. And time after time after time after time, friends and family members can actually make the situation worse by saying, why don't you just leave? As
Mm-hmm.
if it were that easy, just a split second decision. And, oh, well, I'll just gather my things and get going. And it's just, it's not that easy.
Well, and then by saying that, they're also sort of blaming you. Like, well, if this keeps happening to you, it's your own fault because you stayed. And like you said, it's really not that simple. Like, you can't just get up and leave. Like, I mean, in my situation and in a lot of these situations, there's usually a lot of financial dependence that's created. You know, I was a medical student. I didn't have a job. I was relying on student loans. And they had managed to create issues enough in our situation that I didn't have the financial capacity to just up and leave. You know, I had limited income and that had been tied up in a ways that were not possible for me to get out. And that's the case for a lot of people. And I remember after it happened, and you know, I was taken to the police station and gave my statement and all that stuff, and the police officers, you know, like, are you pressing charges? Like, you need to create a protective order, do all these things. And the process for me to even get the protective order, if I was not as like educated and didn't have a full-time job I had to go back to immediately, I don't think I would have even managed to get a protective order. It took so much work on my part. And I just remember thinking, like, if I was a mom of kids who worked, how on earth would I ever be able to get this done? There's absolutely no way. Like, I got I think it was like a month and a half off of my med school rotations to be able to like figure out my life. And this is 100% of the time what I was doing was trying to figure out all of the legal steps that had to be taken. If I had had kids and a job that I had to report to, I don't think I would have been able to do it.
And when push comes to shove, it's just a piece of paper. That's what
Well,
it
and
comes
that too. And
to.
you know, and that was the other thing. You know, mine was violated, and so I did call the police, and they were like, you know, the way that it was violated, I guess, was not violent enough for them to take seriously, and they're just like, okay, we'll write it down. It's just, you know, it's
Wow.
You do find you kind of feel like you're in the twilight zone. Like, what is happening? Like, we know this is a serious problem that kills so many people, and yet it's happening. There's proof. There's documentation, and you're still not believed. You're still no one is still helping you. You kind of are. The system kind of leaves you on your own.
Yeah. So now you are successful, you're healthy, you're thriving, but point A to point B, I'm sure was not a straight line.
No.
So in terms of sort of the aftermath of an abusive relationship, in terms of, you know, I'm biased. Obviously, I'm going to recommend psychotherapy and plus or minus medications and whatnot. But what can a victim of abuse do outside of those things in terms of self-care, just to make sure that they're kind of getting back into functional society and not just surviving, but return to thriving baseline?
Yeah, I mean, I think one of the biggest supports that I found initially was there's a charity in the Houston area called ABDA, Aid to Victims of Domestic Abuse, and they focus on helping victims with these things. So I found them calling all the numbers on the list that the police officer gave me, and they were so helpful because they know this how this goes. They know the process. They navigated me through step one, and they also like have indigent programs. So regardless of your ability to pay, they'll be able to provide you with services. And I think, knowing that there are resources out there, you may have to do a little bit of your own legwork to find them, but reaching out and taking them and realizing that you deserve to have that help, and there's nothing wrong with taking it, and following through with all the steps. Because I think what can happen, it gets a little bit hard and you kind of fall back into the same pattern, but you have to know that you have to keep pushing through. You have to keep going through all the steps that they recommend to make sure that you don't end up back in the same situation. So finding, and I'm sure most major cities have resources similar to this. And if you're in a rural area, whatever the nearest metro area is, will have some sort of resource like this. And then I think it's after that, it's like you said, it's not linear and it's a long process. Like I wouldn't even say that I'm 100%. It still affects me, but you have to intentionally every day decide that it's not going to define your life. And on the worst day that you have, still make the decision that like, I'm going to move forward. I'm going to do what I need to do to get to the next step. And I'm going to allow myself to accept the help that's available to me, however much that is or isn't. So
I
yeah,
think
and that does include therapy, 100%. 100% includes therapy. I always joke that I will be in therapy forever, which I don't think is really the intention of therapy, but for me it works. So we're gonna keep it that way.
sometimes you need the support when you haven't gotten it elsewhere,
Yeah.
And I think what you just described is beautiful in terms of the example of how a person can move from being a victim, being victimized, into a healthy, whole individual. Because I think there's a difference between being a victim and having a victim mentality.
Mm-hmm.
Because you could run out here and be hit by a bus, you could be raped, you could be murdered, you could be whatever, and you could be a victim of a violent crime, you could be a victim of domestic violence, but that's something that happened to you that was out of your control. Everything past that is within your control.
Yeah.
And to not use what happened to you moving forward in your future as a reason not to do things. And I think that's where people kind of get stuck. First of all, leaping the chasm, just asking for help is the biggest step anybody I think is ever going to take, because it's almost Pavlovian when you are in a scenario where you ask for help, ask for help, ask for help, and every time you're slapped down, either verbally or mentally or physically or sexually. And so you're sort of trained not to even bother asking for help because you assume you know what the answer is going to be. It's not only going to be no, but you're going to be punished for it too.
Mm-hmm.
And so I think reaching out, taking that first step and asking for help is the biggest chasm to breach. If you were a friend or a family member of yourself going back looking at that time, what do you feel like would have been the best offer of support or love that they could have shown you?
So my best friend at the time was this person, and she, she's still my best friend actually, but she never deserted me or cut off contact with me, even when I was being my most irrational and doing, I was being a bad friend to a lot of people because things were being coerced and set up in a certain way in the relationship I was in, and I did lose a lot of friends in that period because of that. And 100% my own actions, so I can't blame it on anyone else. But it just, the situation was as it was. But she never cut off contact with me and was always just a supportive person. And there was one time when she had a party she was throwing. Me and my partner were supposed to go. He at the last second was doing his usual thing, trying to stop me from going because I think he could tell she was a strong person for me. And I decided I would leave, but I was very afraid to go home because I knew he was very angry, and he was texting me the whole time I was out. So I was very afraid to go home, and she was no questions asked, like, you can sleep here, stay here. You can stay as long as you need to. And never gave any hesitation to like whatever it was that I needed in that moment. She could just kind of tell that it wasn't right. But she also didn't push me, like you said. She never said, like, why don't you just break up with him? She never said anything like that. She just reflected to me the things that she was seeing that were concerning and offered support when she could. But she never tried to force the issue because I think she knew that would put a break between us, and then it would be impossible to help me get out. So I think the way that she handled it was the best way that anyone could handle it.
Just showing you love and planting the seeds, being supportive. Because I think a lot of friends and family members in this situation don't know what to do except for suggest that you leave, and they can in turn wind up becoming another bully in your life, right?
Yeah, yeah. And I mean, and like you said, like planting the seeds, but also like planting the seed that like you deserve better than this, because when you're in that scenario where you're being, like you said, slapped down over and over and over again, you start to believe that's what you deserve and that you don't deserve anything else. And so anything that happens to, well, this is what I deserve anyway. I'm a bad person. Like this, I got myself into this situation. But just planting the seed like this is not what you deserve, and you deserve better. And having that little like inkling still in your brain from someone, because it's not coming from anywhere else.
I talk with my trauma survivors a lot about how feelings are real and they are understandable, but they're not necessarily true.
Mm-hmm.
And so, a lot of the things that happen to folks in your scenario, while it didn't kill them, sometimes the things that your brain tells you about the judgments that it makes about you as a person turns into actively killing you after the fact. And so our minds can be another way to abuse ourselves, even if the abuser isn't as active in our lives as well.
Mm-hmm. Well, and that's, I think, so often, people will maybe leave one partner but end up with another one just the same. And it's because, again, like you feel like this is what I deserve. This is what feels comfortable and normal. And so I think you do need to have that external input that like, no, this is not okay. What's happening to you? And you deserve better than this.
Mm-hmm. I used to use the example of people who had children, or if they didn't have children, if they had a niece or nephew or a loved one. And I would ask them, for instance, if a husband was speaking ill of a wife or he was hurting her, how would you feel if he treated your daughter this way? How would you feel if he treated your niece that way? Oh, no, that's not okay. Okay, then why is it okay for them to treat you that way? And so
Mhm.
sometimes it takes that sort of shift in perspective for people to look at this child is worthy of protecting, this child is worthy of saving, this child is worthy of having a good life. But if that's the case, then why aren't I? And why am I not allowing myself to have it?
Yeah. And I've even, I mean, I don't know if it's my therapist that said this to me or if I read this somewhere, but like using a photo of yourself as a child and like the things that you're saying to yourself in your head, looking at the photo of yourself and like, are you telling this child those things? Or like, can you really say that to that child? Because, I mean, regardless of mistakes we've made of things or things that we've done, like it's a collection of circumstances in our upbringing and lots of different things that result in the actions we take. And we still are responsible 100% for our own actions, but we have to also have that understanding and empathy for like the person we were at that time who made that choice.
Mm-hmm.
And does that person, are you still that person? And how did you get to be that person? It's not so black and white. And so I've always found that a useful analogy, and I've even recommended that to patients at times when I hear the things that they say about themselves.
Mm-hmm. Have you ever, in terms of just sort of getting out and trying to socialize a little bit more, have you done things like tried to pick up a new hobby or like going out with friends where you sort of force yourself to be more outgoing than you feel in the moment, like when you're sort of actively recovering from walking away from an abusive relationship? I mean, what other things would you recommend outside of obviously therapy, and domestic violence groups in your area? That's fantastic suggestion. What else would you recommend?
Yeah, so I actually did take up sewing after this happened. I moved into an apartment by myself for the first time. I'd never lived alone before, and so previously I always had like my roommate or my partner that I was living with, and so we would do things together in the evenings. But I lived alone for a while, and so I took up sewing, and sewing was it's very therapeutic. And I've since learned, like, I think it's something to do with like using both sides of your brain at the same time, like the logical measuring, cutting, like very like numbers focused side of your brain, and then also the more artistic, hands-on, creative side. Using both of those at the same time, it's very hard for your mind to like spiral down the little spirals that it goes down when
Mhm.
you're actively using both sides of your brain. And it was actually very healing for me also in regards to the eating disorder because, you know, I was no longer participating in any eating disorder behaviors at that time exactly. but, um, but, the body image issues and all those things were still going on. And when I actually started sewing my own clothes, it helped a lot with that as well because you start to get a more objective view of your body rather than an emotional one because you're like looking at the pattern. And you're like, okay, which size do I cut? Well, measure all these things. This is the size. It doesn't matter what like size it is on the rack at the store
What you think?
or you pick it up from the store and it doesn't fit you right and you're like something's wrong with me. It's like, no, they cut it wrong. um, and so when you're doing it yourself, it's like, I'm not the wrong size. This garment is the wrong size. Um, and so I thought, that was really helpful for me. And that's still a hobby that I have when I have time because I have two kids now. So, you know, less time now than I used to
Your
have.
your expansive free time, right?
Yeah. Yeah. The free time. And I really didn't do it very much in residency because, residency. But, I think having a hobby like that, in particular for me, like that garment sewing, I think had on multiple levels was very helpful. And it does just sort of put your brain in a different place so that you don't
Mhm.
continue to ruminate and focus on the negative things. You're focused on creating and producing something new rather than perseverating on the past.
For sure. God bless the people who can meditate. I'm not one of them. I like if I slow down enough, I'm like a shark. If I slow down enough to meditate, I will fall asleep. So I love the idea of like active meditation. I'm a knitter myself, and so like anything that kind of puts you in the alpha wave state, that Zen, contemplative, meditative, but also slightly analytical, like you're saying, using both sides of your brain to produce something and to be active with your hands, and you have to focus on it enough to not make a mistake, but you're not focusing on it in the like negative death spiral you can go into when you're traumatized. I love that. Plus, you're doing something new. You're making something out of nothing, in essence, and you're creating new connections in your brain that have nothing to do with your trauma,
Yeah,
which is a really good thing because you can pluck weeds from your garden, or you can plant it so full that weeds have a hard time growing. You know what I mean?
absolutely. Yeah, yeah. And I think, yeah, I mean, I think there's also just like that satisfaction that you get once you've completed it. And it's like, I did this, like it makes you feel like there's more worth to you than what you were telling yourself. Like this is something that I created from, like you said, from nothing. It kind of overrides some of that negative self-worth that you can perseverate on as well.
That's fantastic. That is absolutely fantastic. Do you find, now that you're a mom, do you find that seeing through your kiddos' eyes sort of changes your perception of yourself as well?
Yeah, I mean, I do. I think I would say the way that these things affect me now is more like I cannot let this happen to you, So I'm like focused on giving them the tools to be able to detect and avoid these situations before they happen. And then particularly like with eating disorders too, like they're somewhat genetic in origin as well. So like I think I focus a lot on what can I do to build the skills and self-esteem and all of those things to sort of prevent a similar thing happening in my children.
Mhm.
And so I think that I don't know if that's my anxiety is focused there now instead of elsewhere, for better or for worse.
Has a positive momentum instead of
Yeah,
negative.
yeah,
I like that. I
yeah,
like that's fantastic. So it's fantastic to know that there are primary care docs out there like yourself who have not only trauma informed practices, also very self aware about eating disorders, body image issues, but also to know that you've been there. To know that you can come out on the other side, you can be successful, you can be emotionally healthy, and only mildly anxious or mildly neurotic. You use it hurt and you like sow things, and that's what you like.
yeah,
I think it gives me a lot of hope too, because I sort of grew up in the era of doctor was God, right? And they never had any problems and they knew everything and they're always right and you're not allowed to question them. But to know that you're human, I think goes a long way in allowing your patients to trust you and to feel safe with you sharing things that they may not want to share with anybody else.
yeah. And like this is something that I have talked a few times with my therapist about, and like something that I always think about is, the concept of self-disclosure in a physician-patient relationship. Like I know in psychiatry this is something y'all probably talk about even more than we do in family medicine, but you never want to make it about yourself or like airing your deep dark secrets in a patient visit. And I try not to bring this up unless I feel that it might be helpful. But the domestic violence thing in particular, like when a patient discloses that to me and they're going through like the early stages that I remember so well, like I often will tell them like, this happened to me too. I get it. You're going to be okay. And I feel like that in particular disclosure I've had so many patients that have told me that it was really meaningful for them to see that there's another outcome than what they can see about themselves in that moment. Because when you're in that moment, you don't feel like there's any positive outcome that can happen.
Everything
Um,
that you project into the future is going to be negatively biased for sure. Yeah.
yeah, yeah. So it's a tricky thing, and it's something I'm constantly reflecting over because I want to make sure that I'm never doing something inappropriate in that kind of disclosure. But I do think that it's helpful, particularly for domestic violence victims.
That's amazing. It's very thoughtful the way that you're practicing, and it's very, I mean, it's ethical, it's thoughtful in terms of, again, not making it about you, but saying, I get it. No, like I get it, but I also get it, right?
Yeah. Because
Yeah.
I think also like when you don't think that anyone else really does get it. And certainly like people, I got away a lot easier than a lot of people. And so I never would assume that I really understand what an individual person is going through. But I think the thought patterns that we get into, regardless of what it is that that happened to you, I know how those thought patterns are, and the hopelessness that you can feel. And so I think just to give some hope, if I can give any, I think is the most important thing.
And to let people know that they're not alone, because their abuser has led them to believe that and has maybe enforced that physical boundary, but also their negative self ruminations and negative self talk have also reinforced that nobody gets it, nobody has done this before. I'm going to wind up another statistic. This is only going to have a bad outcome. And so to let them know that they're not alone, I think, is a fantastic way to even begin to plant the seeds of hope in a person in that scenario.
Mm-hmm.
That's huge. Oh my gosh, I would love to talk to you for another hour and a half. No, our time is up. So, but thank you so much for coming on our podcast. We are so grateful. And if anybody is blessed to be in the Texas area to see Dr. Berens, how would they get a hold of you, madam?
Yeah, so I'm on social media, Instagram and TikTok at Rebecca Berens MD, and my practice is called Vita Family Medicine. It's in the Houston Heights area, and that website is vitafamilydpc.com.
And Berens is Berens.
Correct. Yeah.
Okay, just want to double check. Excellent. Thank you so much for your time. I really appreciate you being on our podcast.
Yeah. Thanks so much for having me.